let's review the definition of dry eye disease. Dry eye disease is a chronic, non-curable disease that affects the ocular surface. It is caused by inflammation, which in turn produces all of the symptoms that you are very familiar with. Targeting the inflammatory process is the foundation of treating dry eye disease. In this video, we will talk about the prescription medications used to treat inflammation. Steroid drops and ointments are very effective at reducing inflammation quickly. Steroids work rapidly. They are essential when dry eye symptoms flare up, but they should not be used frequently for long periods of time. Steroids can cause high pressure in the eye. Discuss your steroid use with your doctor if you have any concerns. Restasis is an anti-inflammatory medication that may increase your own natural tear production. Restasis is 0.05% cyclosporin. Cyclosporin is an anti-inflammatory medication that can be used long-term without the side effects of steroids. Restasis can be used safely for extended periods of time. Restasis is used twice a day and does cause stinging, so consider keeping your Restasis in the refrigerator. As well, you can apply a drop of artificial tears before and 10 minutes after using Restasis to reduce the stinging. Each day, you will open a new vial of Restasis. Once you take the cap off, you can place the cap back on and leave the Restasis upright in the container in your refrigerator, so you can use the second dose later in the day. Restasis is now also available in a multi-dose bottle. Remember, it can take 2 to 3 months for Restasis to be effective. Don't give up during this time. Xiidra is another anti-inflammatory medication used to treat dry eye disease. It is dosed twice a day and comes in a small vial, which should be discarded at the end of each day. Xiidra can be used safely for extended periods of time. Xiidra is used twice a day and does cause stinging. As well, you can apply a drop of artificial tears before and 10 minutes after to reduce the stinging. It can also produce a strange taste in your mouth. These symptoms are not dangerous and should not discourage you from staying on this medication. Many ocular medications cause stinging. This is because the pH of the medication is different, either higher or lower than the pH of the tear film. The nerve endings of the ocular surface react to the pH change, and this produces the stinging sensation. This does not damage the eye, but if the stinging is too much for you to handle, let your doctor know. Don't discontinue your medication. It is also important for you to know that anti-inflammatory medications like steroid, Restasis, and Xiidra do not replace your artificial tears. Continue to use your artificial tears, gels, and ointments, and remember, there is no single medication that will relieve all of your symptoms. There are new medications being developed for dry eye disease, so stay tuned.